Well, the two potentially new treatments that are being explored in CIDP have been, we discussed them at the AANEM meeting, but the FcRn inhibitors, which showed a favorable response in the argenx trial of efgartigimod, and the complement inhibition that's was reported to have an effect in a smaller phase 2 type trial. Both of those are exciting potential new treatment avenues that may change the landscape. And then there are other things, that need to be explored in terms of immune therapy. And so the way I tend to look at it is I look at the MS field, I look at the myasthenia field, I look at the rheumatoid arthritis field, and some of the treatments that are seen for some of those disorders may have some relevance to CIDP, and we'll see how that goes for the future. Certainly, the FcRn inhibitors are now approved for myasthenia. Complement inhibition has been approved for myasthenia, and the question is, will it work in a reasonable fashion for CIDP? And I am quite encouraged that both of them may well be a totally different approach to the disorder than what we currently have. New positives and potentially different risks. So where it gets complicated, and to some extent we're seeing this in the myasthenia world and the MS world, there are now lots of options to treat, and how doctors and patients have their discussion of what to use gets trickier and trickier when you have more possibilities at your disposal. A luxury of riches, which is not a bad thing. What we don't have are cures, and whether cures will, and none of the medicines that we're looking at right now look to be curative. Remission rates in CIDP are very low in general. Probably a third can go into a short-term remission, and probably 10% or less can go into a long-term remission. So we still don't have the treatment that will, quote unquote, stop the disease and allow you to live life without being treated. Maybe CAR T will at some point have some benefits for some of these disorders. We wait to see. Clearly, gene therapy is an exciting avenue for a lot of different disorders. Not clear that they're going to be all that exciting for the immune and inflammatory disorders, but for, the genetic diseases, obviously they will, the potential is there for almost any genetic disease. It's just a lot of genetic diseases. And so, when will your genetic disease be tapped for a treatment remains to be seen. But I think there's a lot of excitement in gene therapy, obviously, and that's great.